Welcome, future nurses. So, today I want to share another secret, right? I've used this, worked for me. Also, student that joined my coaching program, I've used this as well to work for them, right? So, yeah, I've been doing this for the past 2 years, helped 700 plus nursing students pass the NCLEX exam, right? And the most funniest thing is that 80% of this number happen to be students that have taken the NCLEX exam before they have failed and they also pass, right? So, the whole goal is always these three things. One, you want to understand the content, right? You want to know how the NCLEX write the question, and you want to understand, right? After these three things, trust me, you are going to pass the NCLEX exam successfully. Right. So follow me. I want to share another secret today, right? I shared a particular secret previously before. Today I'm going to share this. Right. This particular one is what? Reverse engineer the question, right? This is a very powerful secret, right? I did this in my previous video, but I did not just tell you I was doing reverse engineer the question in that particular video. I was just, explaining a different thing entirely. But I want to now utilize this now. Now, let me give you the game changer. Now, you want to stop reading the question first. Instead, you want to read the answer first. Now, your question is like this, right? Your answer keys, right? But instead of reading the question first, you avoid reading the question first, you read the answer key. Now, a lot of my students know this because on Zoom, this is what I always used to do. I just like scan through the answer to like get an idea what the examiner is really thinking, right? Because the most important thing is to understand the mindset of the examiner. The moment you can understand the mindset of the examiner, you have the ability to know what the examiner is thinking and the appropriate answer to select. Now, let me give you an example. Now, if someone tell you that they drank water. Now, you are the nurse paying attention to this statement. Now, can you tell the reason why this patient had water recently? Obviously, you can tell. Is it that they are dehydrated, they were thirsty, or maybe after eating they had to drink water, right? So, or maybe they were taking their medication, they had to drink water. We can easily think through why the patient made this statement. Are you getting me? Now, that is the same way every NCLEX answers are being written. You can easily read the answers and start thinking through what the answer is trying to direct you towards, right? And then when you understand what each answer is directing you towards, now that is now when you want to now bring it back to the body of the question. That's the reason why this is very important. I tell my students, you need to know the three parts to every NCLEX question: the body, the stem, and then what? Your answer keys. Right? Because once you create that understanding, you can track it back with the body to see what the examiner is really testing, and then that way you know the answer. You like the answer is just going to reveal itself naturally, right? I don't expect you to be good at this. I don't expect you to be 100% at this. I just expect you to be 75% at this. Right, and you'll be able to pass the NCLEX exam successfully. Just pay attention. We are going to do example, but let's read what I have on the screen. Right. So you want to read the answer first, not the question, right? Because it tell you what the question is really fishing for. This way, you will start spotting trap and distractor from the start, right? So you want to look at the answer first, then read the question. You can see what I said earlier on. You look at the answer first, then read the question, because now you can now easily tell what the question is saying. Because if you successfully understand the answer, you find out that one thing in the body of the question is linking back to the answer, right? Something you understand in the answer, right? So now you will read it with purpose. Now you will spot answer that are talking about something in the body of the question. You see what I said, right? Now then you ask yourself, what do they want me to think? And what would a real nurse do that is safe? Now, there's one thing I want you to know is this. A lot of students think safety as a patient is going to die. No, safety is not all about a patient that is going to die immediately. No, there are safety concerns that you do now that can cause problem maybe in the next 3 days or long period of time, but you are just trying to avoid it now. It's just like now, take for instance, you inserted what? Urinary catheter, and you are trying to prevent infection. Right. Infection cannot just start now and start causing problem now. No, it will take a long period of time. Even if you don't try to prevent that infection, it will the patient is going to have the infection, but that infection is not going to kill that patient immediately. So you are applying safety, but that patient cannot die that particular period. But a lot of people, when they think safety, they think the patient is going to die now. No, it's just like now. Also, we have emotional part of safety, and we have the physiological part of safety. You need to know that. It's just like now, if I see a schizophrenia patient hallucinating, I can easily tell that there's a safety issue right there. Now, I don't need to give that patient medication to solve that safety issue. I just need to what? Communicate. Ask what the patient is, the voice that the patient is hearing. That way, with my communication, I'm solving what? That safety issue. Unlike maybe the physiological state of a patient, maybe a patient have what? Low blood pressure. All I just need to do for this patient is what? Give them IV fluid or medication to solve it. Right. So some people don't know you can use communication to fix safety issue without not treating the patient, doing crazy procedure or something like that. Right. So these are thinking you need to fix before you attempt the NCLEX exam, because safety issue is not only about giving medication, giving crazy intervention and all that kind of stuff. So yeah, I just said I should put that out there, right, so that you can easily think through the exam, because your 85 to 150 question are all testing you about safety. Now, the better you are at reading between the line, the more you will feel like the NCLEX is predictable, because it is. This is key. I cannot lie to you. The NCLEX is very predictable, and I'm going to show that to you now. Now, look at this question. We've done this question, but now this time around we are using what? The reverse engineer question method. Now, look at the question. Now, I'm not going to read this question. The question. I'm going to pay attention what to the answer key. This is. Let me give you the breakdown of this question so that you understand where I'm paying attention. This is the body of your question. This is the stem of your question, and then this is your answer keys. Right, these are your answer keys. So I'm only going to pay attention to the answer keys. Now, the same theory I used previously, a patient told you that they drank water. So now, if I want to think, I will ask myself, why is this patient saying they had water recently? Because maybe they might be thirsty, dehydrated, had medication or food, right? These are my thinking, right? So now, same way, I'm also going to think about all these answer keys. Now, I will ask myself, why do we give beta blocker? Obviously, there are two reasons we give beta blocker. Whether is it that this patient, I'm not seeing the body right now, but I'm thinking whether the body have to do with what? Increase heart rate or increase blood pressure. That is what I'm thinking right now. So when I have all this thinking in mind, then I'll come back to the body to come and check it. But not now. Let me evaluate every other options. Now, transcutaneous spacing as well too. Where I'm going to think about it. So transcutaneous spacing help to increase heart rate. So I'm thinking whether there's situation in the body that have to do with decreased heart rate. So I'm taking note of the problem. Right. Now, Valsalva maneuver have to do with what? Increased heart rate, right? So I'm thinking if this patient would have increased heart rate, Valsalva maneuver help to decrease the heart rate. So maybe something in the body have to do with increased heart rate, right? Now, begin chest compression. Like on the NCLEX test plan, NCLEX want you to know basic life support. Now, when do we begin chest compression? According to basic life support, when the patient is unresponsive, not breathing, right? So now, based on that, I'm going to pay attention to what? Unresponsive or patient is not breathing, right? So I want to see that in the body of the question. I'm going to come back to the body of the question. Now, assess the client for angina. Then I'm going to say whether the body is talking about what? Pain. So now I have all this thinking now. Let me now tell you something, because a lot of students always used to ask this. I've been coaching for the past 2 years here. I have every question you might likely be asking. Now, a lot of students will say, what if I don't know what each of these represents? Now, let me tell you something. The only reason why you might not like is just like now. Let us say you have 85 questions on the NCLEX exam. I can be so sure that if you did well in nursing school, I'm not saying excellent in nursing school, you did average, right? In nursing school, your 85 questions, you should be able to identify 60 to 70% of the what each answer indicates. If you don't understand, then it means that there's a problem. There's a big what problem, because you need to be able to identify all these, right? And it's not a problem that cannot be solved. I'm only just trying to tell you, you need to fix that problem before you even decide to start studying. Because question bank, and that's the reason why a lot of people will use various question bank and still fail the NCLEX exam. I have a particular student who joined my program after failing the NCLEX exam 14 times. This particular student have been using question bank upon question bank. She stopped using question bank, right? After getting 7 program, right? After getting 7 program. Now she said all were question bank. Now if you multiply 7, let us say each question bank have 2,000 questions. If you multiply 7 by 2,000, that is going to give you 14,000, only to attempt 85 to 150 question. But guess what? She has started taking the NCLEX exam when it was 75 to 265. Right. She has started taking the NCLEX exam at this point. Right. So now think about it. If you are to attempt just this question and you've practiced 14,000 questions, is that not enough to make you pass? But the problem is not question. I tell students, if you pass with question bank, you already have the knowledge to pass the NCLEX exam. Question bank just gave you that confidence to make you what? Feel like you are going to pass. Without question bank, you can pass. With question bank don't guarantee you to pass. Right? It's what you have, the knowledge, the content knowledge that make you pass the exam. Right? So now, if you don't know what the NCLEX is putting as the answer key, then why are you attempting the exam? Because you need to know NCLEX is giving what? Entry level nursing knowledge. So they are giving you something that, okay, within your 12 months of what? Practice. These are things you need to know. So these are basic things they feel like you should know. NCLEX is not giving you advanced answers like I've seen most question bank giving you advanced kind of answers. I will see those kind of questions and I will tell you those kind of questions cannot be on the NCLEX exam because they have advanced answer that shows that you have more than 2 years in practice. NCLEX don't give answers like that. NCLEX give basic answer that entry level nurse supposed to know, because the question is testing your readiness to practice, not your practice. Because you are just starting, you just finished nursing school. Why should question start testing you like you've spent 5 years in nursing? No, it's wrong, right? So most questions like that on different question bank are like that, but that is another story for another day, right? So now you should be able to answer. If you are not able to get every knowledge of each of the answer key, I can tell you. Let's say you are taking 85 questions. Maybe you answer the first question, you don't really understand the answer keys like that. Second question, before you answer 3, 4, 5, you will know that you will find out that 3 out of 5, you know what each answers are telling you, right? You know what each answers are telling you, because obviously your nursing school should not go to waste, right? Your nursing school knowledge should not go to waste, because that is what nursing school is building you for. I'm trying to clean up, right? So there's nothing I can do at this point. If you don't know this, then you need to learn right from what? Scratch, right? I can help you that way as well to learn right from scratch. But I'm trying to like give you the knowledge that okay, this is what I want to say. Like I'm acting like we already know what all this mean. The only problem we have right now is that we don't understand the question. So we are trying to use reverse engineer in order to what? Answer the question by reading the answer key first before we try to understand. And remember, right, I said for this, the first one, which is beta blocker, it look like something is going on, that the patient have what? Increased heart rate and what? Increased blood pressure, right? Now, transcutaneous pacing help to increase the heart rate. So it look like maybe the patient have decreased heart rate, right? Passover maneuver decrease the heart rate. So it look like this patient have what? Increased what? Heart rate. This, maybe the patient have no pulse and the patient is not responsive, angina, pain. Now, this is what we now do. We are now going to look at the answer keys and the findings. All I can see right here is heart rate, heart rate, heart rate. So I can 100% tell you, based on I'm seeing heart rate, heart rate, heart rate. It look like this question have something to do with heart rate. This is the secret. I'm not hiding anything right now. I'm just giving it to you. This is what I give to paid students. This is what I give to 700 plus students that have passed the NCLEX exam successfully, right? This is shortcut right here. Now, there's something about this question that is talking about heart rate. I don't know if you want to fix. I'm acting like I don't even know what this ECG means, right? Because I want to like put myself in your shoe, your thinking process, so we can navigate the question together. Now, I know this problem has something to do with heart rate because every answer is screaming heart rate, heart rate, heart rate. Now, is it I can have issue with increased heart rate or decreased heart rate? But how do I know? Right? I don't know how to read ECG, so I might not even know from the ECG. Right. Now, there's one thing you should know. If you know what chest compression means, then you know what chest compression can work for. The kind of ECG chest compression can work for. Because if you know what chest compression means, then you've heard that asystole, right? That straight line kind of ECG, which shows no pulse. Now, if you see a particular ECG that have no pulse, this is how it look like, straight line. But something is looking like this, obviously there's pulse. So we definitely know it will not be this answer because obviously even if I don't know anything, there's pulse. Now, let me tell you another way to still spot it. Right? If you don't even know systole, let us say you don't know systole. If you don't know the second thing I want to tell you, then there's no how I can help you. Now, a patient that is not responsive, are they going to feel fainting? Obviously, they cannot feel fainting. First of all, what is being responsive to you? Right? It can either be by you communicating back when you are being called upon, or maybe you are responding with by looking at that direction, or you are responding to stimuli, right? So now, will a patient that is feeling faint, are we going to say they are not responsive? Obviously, they have life in them. At least they are just feeling faint, they have life in them. So even if this patient cannot respond to you by speaking out, they can still respond to your touch by looking at the direction of the touch or sensation and all that kind of stuff. So feeling faint automatically means that this patient will definitely be responsive. So obviously this is out. You can see the clue I'm picking. I'm picking the clue from what I've analyzed here, and I'm looking at something in the body of the question that is mashing up. I'm not really seeing pain in my question, so I don't know why the NCLEX is saying I should assess for angina, right? But I'm going to still hold on because I'm not seeing a clear thing that is making me to eliminate this until I see something that is clear. This was so clear for me to eliminate. That's why I eliminated that. Now, I'm seeing heart rate, increase heart rate, low heart rate, but I need to know what we are trying to fix here. So that's why I need to ask myself, okay, I don't really know the ECG, but I know this patient have pulse. Patient is feeling faint. That is the next clue I need to look at. So now I'm going to ask myself, a patient that is having increased heart rate and low heart rate, which of them are going to feel faint? Obviously, low heart rate. That's the reason why the NCLEX want you to know vital sign and sign when they are abnormal. Now, feeling faint is a sign of what? Can be a sign of low heart rate. So I definitely know this patient is experiencing low heart rate, even when I don't know the ECG. You can see how powerful this is, right? So obviously, I'm going to be thinking about answer that what will increase the heart rate, because the NCLEX is asking for answer to fix this problem. So I've spotted that this problem have to do with low heart rate, and I'm trying to look for answers. And the only answer that we fix right here, this will not fix because this is going to decrease further the heart rate. This is going to decrease further the heart rate. This is going to increase the heart rate. This, we cannot use this because it's not applicable, right? So now, guess what? You see, earlier on, I don't even know how to classify number 5, but guess what? Look at the clue that I am picking from the question. This question is a select order apply, so it makes no sense for it to be one answer. We only have one answer when it have to do with standalone question or multiple choice question, but this question is a select order apply, and I've eliminated 1, I've eliminated 3, I've eliminated 4, then I'm left with 2. So obviously I have to believe 5 is part of the answer. But this is me answering the question like I have no knowledge. But I can tell you 100% for sure that a patient that is having angina can experience what? Low heart rate. So this answer also is definitely correct. The answer to this question is 2 and 5. You can see how this method is working. We call it what? Reverse engineer the question. You start with the answer and you work your way up to the question. Now, look at this other question. We've done this as well too, but let's use the reverse engineer. Now, I'm going to look at this. So think through it with me. What do you think is happening right here based on what the examiner is saying? I would say maybe infection. What do you think is happening right here? I would say maybe there's an issue with what? The assignment. What do you think is happening right here? There's an issue with what? The assignment. And look at it right here. They are saying switch assignment. There's issue with the assignment. So the answer choice is screaming assignment, assignment, assignment. Now let me look at infection. Is there any infection in the question? Obviously, yes, there's infection, right? Is there assignment in the question? Obviously, yes, there's assignment. Now, but the problem is this: assignment is here, infection is here. But now look at what is going on. The NCLEX is saying they have this condition, but guess what? They are receiving therapy. So this don't become a problem again. This is what we are thinking about. Why? Because on the NCLEX exam, if the NCLEX say somebody have diabetes and their blood sugar is high, let us say 170, and they are receiving their insulin, it means that NCLEX is not testing you about this increased blood sugar again. Instead, they are testing you on your evaluation of what? The insulin therapy. It's no more this again, because now it's just like a patient who have um eh, uh, hypertension and they have what? Headache. Now these patients still have the problem. There's no intervention done to fix what is going on. Unlike this one, the patient have the infection and there's intervention already done. So when there's an intervention already done, it means that what the NCLEX is trying to test you, or what the examiner will be testing you, is going to be what? Evaluation. Makes sense, right? You give a particular medication, you evaluate. You give a particular treatment, you evaluate. Patient return back from procedure, you evaluate. Everything we do, posts, after, whatever we do, is to evaluate. So now, if it's only this and then this is not there, then I will say, okay, it is this. But guess what? NCLEX cannot do something like that. Test us on assignment and test us on the infection at the same time. No. Right. So they have to test us on one. That is the reason why they immediately included that the patient is receiving therapy, so that it will not look like we are trying to fix this problem no more, because the problem is already currently being what? Solved. So now, but my answer is screaming assignment, assignment, assignment. Right. So, but this one is screaming infection, but guess what? The infection is being solved. So it can never be the infection again. That will be the problem, because the infection is already being solved. Because you see, I checked through the answer key before I come to the body. So I noticed that this is being solved. I'm left with 2, 3, and 4. So automatically, this is already telling me that my body of the question is testing me on assignment. So now I need to read the answer to be sure which answer is right for assignment. So if I am talking about assignment, right? Assignment come from who? The charge nurse. So if this is saying we should change, this is saying we should discuss, this is saying we should change, this is saying we should discuss, this is saying we should switch. Is this change, discuss, switch is already speaking something to me. It's speaking that something is wrong. It look like something is wrong with the nurse and the nurse need to change. This way, I'm not even thinking about what is happening. Now, you remember we are thinking like we don't understand the question. So I don't want you to start thinking, oh, if a client have this kind of therapy, a pregnant lady cannot be around the client. No, don't think like that yet, because we are answering this question like we don't understand the question. I'm not thinking that. So now I'm using the clue in the answers to answer the question. You can see I'm not thinking that and I'm answering this question, right? Now, change, discuss, switch. It looked like something is wrong with this assignment. Now, the question NCLEX is now asking you, what would you do when you are trying to like fix an assignment? Are you going to discuss it with the physician? Guess what? The only business the physician have with you is about the client. The physician don't care about your assignment. That is the charge nurse problem. Right. So now this is out. You are left with 2 and 4, because physician don't have business with your assignment. They only have business with what? The client. How is the client doing? That's what they want. So this is definitely how this is at. You are left with 2 and 4. Now, one is requesting to change, one is trying to switch. So which one is proper? Which one is safe? This is not safe, because the charge nurse is not aware. The charge nurse assigned a task to you and you switch with a co-worker without the knowledge of the charge nurse. That is not right. Even if a registered nurse can delegate tasks to another, maybe UAP or LPN, but the initial person that delegated the task to you need to be aware, because she's still going to be accountable of what she delegated. So if you switch without the charge nurse knowing, it's a problem. So the right source you need to seek change from is the charge nurse. So number 2 is correct and number 4 is wrong. So the answer is what? 2. You can see how we think through this question using what? The reverse engineer, right, of the question. Now, let's do this last one, right? Let's do this last one. Now, so look at this. This is saying take a nap when your baby is sleeping. So my mindset is like, okay, if this mother, maybe if this person, right, don't take a nap before sleeping, the baby is going to disturb. So maybe I'm trying to like, so what I'm thinking right here is that, okay, we are trying to like get good rest. You can put your statement, what you're thinking. This is what me I'm just thinking. You can use your statement. All statement is right. You don't need to have a perfect statement like me or the same statement as me. Now I'm thinking about maybe they need a good rest without disturbance. So let me just say without disturbance. This is what I'm just thinking, right? Without disturbance. So wake up and go to sleep at the same time every day. This is also, maybe you are trying to have a regular sleeping pattern. It's just like now you are trying to take medication same time every day. That is like taking medication the right way regularly. You understand? So like doing something the same time, exercise, regular exercise the same time every day, exercise the same time every day, sleep the same time every day, check your blood pressure the same time every day. So we are trying to like have something regular, accurate, or something like that, if I'm making sense, right? So that scream regular sleeping pattern to me. Right now, the other one is saying on the weekend, plan and prepare all meal for the week to prevent fatigue. So we are trying to manage what? Stress here. Now perform all your household chores in the morning when you have more energy. We are trying to what? Manage stress. Now the key right here is that I'm seeing two things in this answer key. One is talking about sleeping pattern, one is talking about stress. So this one is talking about sleeping pattern, this one is talking about stress. Now, in order to manage stress, we need to find out how the client is managing stress. Now, they said on the weekend, plan all meal for the week to prevent stress. Now, guess what? We don't do anything all when we are trying to manage stress. You don't do all your house chores, you don't do all meal planning, because guess what? Even if you rest and you come back to do all activity, you will get tired back again. So you are not managing stress anyway. You are just like resting and coming back to get fatigue. So that is not managing of stress. So instead of doing all activities, right, you want to pace your activity. You want to share it. Maybe you do some in the morning, some in the afternoon, and somewhat in the evening. Now look at what the NCLEX is saying. Do all in the morning. No, that is wrong. The patient will get stressed again. Do all meal for weekend. The patient will get stressed again. So this is not a proper way to manage stress. Instead, they need to pace the activity. They need to share it. They need to distribute it. They don't need to do all. So all red flag. Right. You can see how I'm able to eliminate this even without not even knowing what the question is testing. So I'm left with 1 and 2. So I definitely know the answer is going to be between 1 and 2. Now I can easily tell the question is talking about either managing stress or sleep. There's one content on the NCLEX exam that have to do with resting and sleeping. Right. It's on the NCLEX, right? It's a test. It's part of the test plan content, resting and sleeping. So now I feel like the NCLEX, this is what, not I feel, obviously that is what the NCLEX is testing. Now let me read the body of the question. So obviously look at it right here. Sleep and rest at home. You can see this is powerful. Now I have already seen that NCLEX is testing something like that. Now I can now continue at home for a client who had what? Vaginal delivery. Now NCLEX cannot just state something without it not having influence on the answer. You need to find out if it's not having influence. Now, this will be applied to sleep and rest if the NCLEX did not include this. But guess what? When the NCLEX say take nap, because take a nap is good. Number 1 is a good thing. Number 3 is a good thing. But there's one that is appropriate for the situation right now. Now, guess what? They said they have vaginal delivery. It means that what? This patient needs recovery, right? Because after delivery you need to rest well. You understand? So she need what? Recovery. So it means that the NCLEX is trying to send us a signal by saying take a nap when your baby is sleeping. It means that what the NCLEX is trying to say is that baby needs much of the mother time. So due to this reason, right, you need to teach the mother to like find time to sleep when the baby is sleeping, because you might not know the next time the baby might be awake and need your attention. So the period of time that the baby is finding time to sleep, you as well to take what? A nap. The NCLEX is not saying you should take a complete sleep, right? Just take a nap. You still have your night sleep, right? But maybe in the morning the baby is sleeping, immediately just use that time to take nap. So that way you are sleeping well and you are resting well to aid what? Accurate recovery. Now, number 2 as well is correct, but it will not be correct for this situation. That's why I always used to tell people, understand the situation. Sleeping is one thing, they apply to the two, but because they are talking about vaginal delivery, a baby now is involved. So why is the NCLEX saying take nap? Because the NCLEX is trying to send you that signal that the baby can wake up anytime and they need your attention. Baby are very, very much active, right? So just find that time to take nap. Unlike saying wake up and go to sleep at the same time every day. What of if the baby, if let us say you go to sleep every day by 7 p.m. What of if the baby is awake and need your attention by 7 p.m.? Are you going to ignore the baby and decide you are not going to take care of the baby because you want to have sleep at the same time every day? Obviously, no, you need to give attention to the baby, right? So that is the reason why this will not be appropriate for this situation, because a baby is involved. So now all these answers don't have baby. Look at the reverse engineer thinking. All these answers don't have baby. This don't have baby. This don't have baby. This don't have baby. This is the only thing that have baby. NCLEX are not stupid. The reason why they put baby there, they want you to think something. There's something about that baby that they are putting there, and it only makes sense because the mother just delivered 24 hours ago. Can you see how the NCLEX want you to think? Now, the moment you can have that ability of thinking, trust me, you'll find out that NCLEX. Look at what I said here. You will find out that the NCLEX is predictable. You can see all I was just doing is reverse engineer the question, and I was able to predict what is going on. And that way it's making me have smart decision to select correct answer. Right. So I want to see you pass. I definitely want to see you pass. So if you are someone that struggle with the NCLEX exam, you are interested in passing the NCLEX exam without struggling, without having to spend more hours, quit your job, or any other thing that you feel like is making you not to pass, I want you to reach out to me now. I'm definitely going to coach you to pass. All you just need to do is to join my coaching program, my paid coaching program. Reach out to me, +1 767 613 0769. Text me now. Right. Text me +1 767 613 0769, and I'm definitely going to help you pass the NCLEX exam in 85 questions. So see you in my next video.